The decision to have knee replacement surgery, medically known as knee arthroplasty, should be done in consultation with your doctor. Factors that he or she will take into consideration include how your knee is functioning physically, your personal health history, your weight, X-ray or MRI results. Here are some important questions your doctor will ask. Is your pain severe when you're sitting still or lying down? Does it hurt both during the daytime hours and at night, possibly keeping you awake at night? Does your pain make it harder to do simple everyday tasks like dressing or bathing? Do you have trouble getting out of bed or a chair or climbing stairs? Do you need the help of a cane or walker to get around? Are you already taking pain medications, especially strong ones, and they don't help ease your discomfort? Have you tried other, less invasive treatment options that haven't worked? These could include cortisone injections, lubricating injections, rest, and physical therapy. Do you have osteoarthritis, rheumatoid arthritis, or some other disease or condition that causes pain and affects knee function? Age is not necessarily a deciding factor, but most people who have knee replacements are between the ages of 50 and 80. Of course, younger people may need knee replacements due to injuries. Such injuries often occur during sports activity or as a result of accidents.